Hello everyone, my name is Ian Miranda, and in today's presentation, we will be primarily focusing on thalassemia. Now, thalassemia refers to a set of genetic blood disorder primarily characterized by the mutation in the hemoglobin genes. This usually is an impairment in the function and number of red blood cells, ultimately causing anemia. Now, there are two primary types. One is known as the alpha thalassemia, and the other one, or the second one, is known as the beta thalassemia. Now, both of which can have a minor and a major form as well. Now, thalassemia primarily affect the hematopoietic system, which includes our bone marrow, spleen, and liver. Hemoglobin is a protein in the red blood cells primarily responsible for carrying oxygen, which is synthesized in the bone marrow. Now, hemoglobin is usually composed of the following. Um, Four folded chains of protein called the globin. Um, Two of those are known as the alpha, and the other two is known as the beta. And along that is a four heme group, which are primarily the red pigmented molecules containing iron. Um, Now, let's go ahead and go over physiology. Normal hemoglobin synthesis involves series of complex biochemical pathway, including the gene expression, RNA processing, and protein assembly, known as a globin, as I have just recently mentioned from the previous slide. Um, Now, usually hemoglobin is the what defines the shape of red blood cells in our body. However, if you look in this photo, on the left, you are able to see what a normal red blood cell looks like, versus on the right, what the red blood cell looks like if someone has thalassemia. As you can see, red blood cells is irregular in shape or is not usually normal in shape. Um, Now, genetic mutation usually affects the production of alpha and the beta globin chains, resulting in thalassemia. With thalassemia, it usually disrupts the balance of alpha and beta globin chain, mainly leading to the abnormal hemoglobin formation and a decreased oxygen carrying capacity in the red blood cells. So let's go ahead and go over pathophysiology. As I have just recently mentioned, there are two types of thalassemia. One is alpha, and the other one is a beta thalassemia. So let's go ahead and go over alpha thalassemia first. Now, what is alpha thalassemia? This is primarily a genetic disorder, mainly characterized by the deficiency in the production of alpha globin chains. That's why it's called alpha thalassemia, in which this is essential component of the hemoglobin. Now, this deficiency results in an imbalance between the alpha and the beta globin chains, mainly leading to the formation of unstable hemoglobin molecules and impaired red blood cell productions. Now, the severity of the alpha thalassemia usually varies depending on the number of affected alpha globin genes. Um, as you can see down here on our slide, two gene deletion usually causes thalassemia traits. A three gene deletion results in significant production of hemoglobin H, and with four gene deletion, that can result in a significant production of the hemoglobin BARTs. And here's also a picture showing an explanation pretty much in regards to what um, alpha thalassemia is. Again, in cases where all four alpha globin genes are affected, severe anemia and potential complications like organ damage can occur, while individuals with the fewer affected genes may exhibit milder symptoms. On the other hand, beta thalassemia results in the reduction or the absence of the production of beta globin chains. Now, this deficiency usually leads to the decreased hemoglobin production, resulting in anemia. Now, beta thalassemia can also range from um, mild to severe, depending on the extent of the beta globin chain deficiency. Now, individuals with the severe form of beta thalassemia may require regular blood transfusion to manage their condition, while those with the milder forms um, may experience less severe symptoms. Um, so, as you can see, there are three different types of beta thalassemia. Um, Now, beta thalassemia minor usually is characterized by one gene defect. Beta thalassemia major, which is also known as a Cooley anemia, and is the most severe form of beta thalassemia, um, is mainly characterized by the significant reduction or the absence of beta globin chain production from both genes. And then lastly, we have the beta thalassemia intermedia, which is the less severe case or the less severe form, mainly characterized by the results in a variable degree of the beta globin chain production. And here again are some photos explaining the different type of beta thalassemia. We have beta thalassemia minor, we have beta thalassemia intermediate, and we have the beta thalassemia major. Um, Now, these disorders are usually inherited in the autosomal recessive pattern, meaning that the individuals must inherit at least two copies of the mutated beta globin genes, one from each parent, to develop the condition. Now, treatment options for beta thalassemia may include, again, blood transfusion would be the primary one, iron chelation therapy to manage the iron overload from the transfusion, and in some cases, bone marrow or stem cell transplantation. Um, Now, let's go ahead and go over sign and symptoms. So, thalassemia sign and symptoms may include fatigue, weakness, decrease in the stamina, sometimes changes in skin color, usually with patient or an individual with thalassemia disorder, they may appear pale in color or jaundice in color. Now, this is mainly due to the decreased production of red blood cells. Um, in some cases or severe cases, enlarged spleen, which is in the medical term for it is splenomegaly, and also it may cause growth retardation, developmental delays, and or bone deformities. Diagnostic test for thalassemia usually involves the following. We do have complete blood counts, which helps measure the hemoglobin levels. We also have specific hemoglobin tests in which it identifies abnormal hemoglobin variants. And lastly, we have the genetic testing, which help detect the genetic mutation. Treatment for thalassemia, usually the goal for treatment is to aim to manage your symptoms, prevent any complications, and also improve the quality of life for the individual. Some options may include regular blood transfusion, um, iron chelation therapy to help remove the excess iron, and then bone marrow transplantation for severe cases. We also have a medicine known as the Reblozyl that the individual can take. And then again, also in severe cases, we can also do splenectomy to remove the spleen for the affected individual. So, what are some artificial intelligence used to help diagnose thalassemia? Um, Now, AI models usually aids in differentiating thalassemia from other causes of any microcytic anemia and streamlining the diagnosis and minimizing any type of unnecessary test. Also, these models help reduce any type of resource usage, allowing physicians to mainly focus on the clinical evaluation and management aspect of it. Um, Now, there are three examples that I want to go ahead and go over with you guys. The first one is known as the Matos and Carvalho Index, or MCI. This is usually developed to discriminate between the iron deficiency anemia and the thalassemia trait based on their hematological parameters. Second one is a uh, pri- uh, Talpride web-based tool, which utilizes machine learning models to discriminate between thalassemia traits from the iron deficiency anemia, achieving high prediction accuracy. And lastly, the neural network evolution by the genetic programming, in which it utilizes genetic programming tool to diagnose thalassemia based on their blood parameters. Thalassemia is most significant in population with a higher prevalence of genetic carriers, such as individuals in the Mediterranean, South Asian, and then the Southwest Asian descent. Incident usually and prevalence vary globally, with the higher rates in regions where consanguineous marriages are usually common. Now with the survival rates usually have improved with the advance in treatment, but however, mortality remains a concern, particularly in the low resource setting with the limited access to medical care. And now here's a 5 minutes video that I found in YouTube that summarizes everything that we have just discussed. Once again, I hope you guys found my presentation informative, and thank you for listening.
Hello, I'm Harry, and I'm your friend. A tiny friend that lives inside you. Where? In your blood. The red stuff that sometimes comes out when you hurt yourself. And I'm not alone. I have a huge family of many, many cells, all of which are red and look like small plates. We all have an important job, and this is to carry oxygen, a substance that you take from the air when you breathe, and one that gives you lots and lots of energy. Many, many blocks of a special stuff called hemoglobin inside us help us to carry this oxygen. I should also mention that we red cells are not alone in blood. Three other families of friends are floating around: the white cells family, the platelets family, and the plasma family. We all have different jobs to do, and of course we look different, but we all work together to keep your body healthy and strong. The white cells are wibbly wobbly and white, and act like little soldiers, fighting off germs to keep you healthy. The platelets look like tiny eggs and gather and stick together like building blocks to help you stop bleeding. On the other hand, the plasma is a yellow, watery stuff in which all of us float and carries many, many nutrients that your body uses to keep you healthy and strong. Do you know where blood and all of us in it come from? Right, from a factory inside your bones. Sometimes, however, there is a problem at this factory and things go wrong. For example, sometimes it can't make red cells with the right helper, the hemoglobin inside. When this happens, then the red cells can't carry enough oxygen, and without this special nutrient, your body feels tired and you look weak and pale. Doctors call this anemia or thalassemia. Lots of children around the world have thalassemia.